This training covers the social story procedure. Social stories is a trademarked intervention process originally developed to support learners on the autism spectrum by Gray and Garland in the 1990s. Carol Gray is still considered the preeminent specialist on social stories, with multiple research articles and books available. There have been a number of resources and modifications and additional applications of the social story process since the 1990s. Because social stories is trademarked, you will sometimes see these modified procedures referred to as social narratives. Basically, social stories and social narratives refers to the process of describing a social situation with directions for how to respond during that situation. Social narratives procedures are applied in a wide range of subspecialties of ABA. They are often used in behavior analysis and education, the behavioral treatment of autism and other developmental disabilities, behavioral pediatrics, and organizational behavior management. There are other applications in other subspecialties as well. We are going to focus on the application of social narratives, social stories, within the educational settings in this training, but I do think that it is important to point out that the majority of the research on the efficacy of this procedure does revolve around a population of young learners with diagnosed ASD. Social narratives are often used to prepare learners for new experiences or to build skills when there is an identified deficit in their repertoire. Social narratives are used to teach a skill, to teach how to apply that skill, or to teach the generalization of skills. They are excellent for social emotional learning, social skills and interactions, and for helping learners understand and navigate complex relational situations and complex emotional experiences. Social narrative interventions can be effectively applied for populations of general education students as well as special education students. They are primarily used in the K-8 years, but not exclusively. As a positive behavior support tool, a PBS tool, social stories are used in all three tiers of supports. They can be used for whole groups for Tier 1 supports, especially in the earlier stages of education. They can also be used as Tier 2 supports for small groups of learners and as Tier 3 supports for individual learners who are struggling. Within these contexts, social stories are generally used to provide learners with support prior to new social experiences and to clarify behavior expectations. Essentially, they are a priming strategy for desired prosocial behaviors. Behavior analysts often design social story interventions and then train teachers and other educational professionals to implement them. A few examples are a general education kindergarten teacher might use a social story intervention as a Tier 1 strategy to teach the whole class what to expect and the behavior expectations for riding a school bus for a field trip. A second grade special education teacher might use a social story as a Tier 2 intervention for a small social skills group, teaching them how to ask to be included in games during recess. And a 6th grade school guidance counselor might use a social story as a Tier 3 intervention for a student to learn about changing clothes for PE class. Effective social narratives are simple, descriptive, use concrete language, are instructive, and usually include some form of visuals. Carol Gray clarifies in her work that social stories should be told from the learner's perspective, from their own point of view. They should use neutral, judgment-free language. And expectations for desired behaviors need to be clear. Instructions always need to be complete. This procedure can be broken down into 3 key elements: descriptive, directive, and perspective. And the research of Gray and Ozedemir really helps us understand these elements. So the first element is descriptive. So in this part of the story, you're being clear about who is involved, where the situation takes place, what is happening, and what behaviors are expected. In the directive element, there are clear instructions for desired behaviors, complete directions what to do. And in the perspective element, there's an explanation of what others in the situation might be thinking or feeling. Social narrative interventions are usually delivered through the reading or the telling of a story. they should include visuals, and these visuals could be the modeling of a behavior, role playing of a behavior, or pictures. Adding some extra visual elements helps provide clarity for learners with auditory processing or attention deficits, so it is really important to include these visuals. So social narratives can be delivered in person or using a video remote format. They can be illustrated or animated and delivered in a recorded format for students to watch more than once. So there's a lot of different ways that you can deliver these interventions, but they all should provide the opportunity for some kind of practice or role play. Sometimes that's representative practice, like one person in a group is practicing, or there's an animated character who's practicing and attempting the skill, but there should be a practice role play element within the intervention. This procedure can be easily misunderstood, and some people will think it's just telling a simple story. So it can be useful to review high-quality social story material prior to developing your own interventions. On her website, Carol Gray Social Stories, there are several examples of social story material available. Also, the Autism Behavior Services Incorporated website has a library of free-to-use social story resources on their website, including videos and PDFs. They are primarily designed for learners with autism, but many of them have wider educational applications, and they provide good examples for developing specific social story interventions for learners you are working with. Social narratives can be incorporated into an overall behavior plan for a variety of reasons. They can serve as an antecedent strategy to evoke desired social behaviors or to reduce the risk of anxiety, serving as an antecedent for problem behaviors. They can be used for skills acquisition interventions to teach a new social skill, as a replacement behavior strategy to demonstrate the use of a desired replacement behavior in situations where problem behaviors have previously been used. They can be used as a generalization strategy to promote the use of behaviors already in the repertoire, but in new environments for learners. One of the factors that can make social stories an effective tool for use for social skills is that they can often provide natural reinforcers for engaging in the desired behaviors. For some social story interventions, the reinforcement will be readily and consistently available in the natural environment. For example, inclusion in an activity and increased peer interaction is reinforcing for many learners. If that reinforcement maintains the targeted behavior, then additional reinforcers do not need to be added. If natural reinforcers are not sufficient to maintain the desired behavior, contrived reinforcements will need to be identified and provided, and then faded out. Prior to implementation of a social story procedure, a clear way to measure success needs to be identified. Depending on the skill and how the procedure is being used, success will be defined and measured differently. It is important to collect data on the effectiveness of the social story procedure to determine if it has met the behavior target goals or if modification to the procedure or the intervention plan needs to be made. These data-based decisions should be included in intervention documentation. For supervised unrestricted fieldwork, design a social narrative procedure for an individual learner or group of learners. Write out your procedure plan, including measurement and data collection strategy. Write out the social narrative and include the visuals for the story. Send that material to me, and we can discuss it at an upcoming supervision meeting.